नमस्कार. लाईव्स ऑन विथ मणिपाल हॉस्पिटल्स या कार्यावळीत परत एकदा तुमकां सगळ्यांक येवकार. ह्या कार्यावळीत आमी कितलेशेच दोतोरांक मेळटात. तांचे कडल्यान वेगळ्या वेगळ्या पद्दतीची दुयेंसां ताचेर आशिल्ले उपाय हे समजून घेतात. नवीं वखदां, नवे तरेची इन्व्हेस्टिगेशन्स हें सगळें आमी पळयतात. आज आमचे कडेन अशेच एक दोतोर आयल्या, जांचो विशय हो तसो पळयल्यार नवो, कित्याक तो आमकां खबर ना. तसो पळयल्यार थोडोसो पोन्नो, कित्याक ताजी ते खूब वर्सां प्रॅक्टीस करता. आमी सगळे जाण आज जाणा की आज हवेंत पोल्युशन खूब आहा. आमच्या नाकांतल्यान भितर कितें वता हेंच आमकां कळना. धुल्ल आसता, डिझेल आसता, झाडांची पोलन ग्रेन्स आसता आनी ह्या सगळ्यांचो परिणाम आमच्या पुलमावांचेर जाता, लंग्सांचेर जाता आनी तातूंतल्यान लंग्साची तरातरांची दुयेंसां जातात. आज आमचे कडेन मणिपाल हॉस्पिटलांतले डॉक्टर प्रभुप्रसाद जे ऑन्कॉलॉजिस्ट आसा आनी पल्मोनॉलॉजिस्ट आसा. म्हणजे लंग्सांचे जे कॅन्सर जाता त्या कॅन्सराचेर तांचो स्पेशल अभ्यास आसा आनी ताका लागून हे लंग्सांचो कॅन्सर म्हणजे कितें, कसो जाता, ताचेर उपाय आसा काय ना हाच्या बद्दल तांचे कडल्यान माहिती करून आज आमी घेवया. डॉक्टर प्रभुप्रसाद, वेलकम. नायस टू मीट यू. नमस्कार. नाव you are an interventional pulmonologist.
Yes.
And an oncologist also. Basically, what is a lung cancer?
Yeah. Basically, I'm a pulmonologist. I'm working in Manipal Hospital for last 3-4 years. So I've been trained in Vellore, especially for the interventional pulmonology. It is a subspecialty of pulmonology where you do interventions for either the diagnosis or treatment of particular conditions in these things. So most of the interventions are related to oncology part of the lung problems. So that is why I have a special interest in lung cancer and thoracic oncology. So basically lung cancer is a condition where there is a tumor or a cancerous growth within the substance of the lung. So basically we need to differentiate clearly apart from the other tumorous growths or cancers. So if you say the cancer or tumorous growth which are in the windpipe and its branches, we club it under the term called tracheobronchial tumors. So if you take a tumor or cancerous growths which are in the lining of the chest, of the lungs, lining of the chest or lungs, we call it as pleural tumors or mesothelioma. Whereas if you see the tumorous growth or the cancerous growth which are in the chest wall, we club it as in the under the term called chest wall tumors. So basically lung cancer is a cancerous growth or a tumorous growth which is within the substance of the lung cancer. Lung is called the lung cancer.
Can you just in short explain how does a lung or a windpipe, from where does it start, how does it end?
Yeah. So lung is one of the most vital organ in the body. So basically it has any human body has got two lungs, right and left lung. These both lungs are connected with the windpipe. So this windpipe usually we technically say starts from the nostrils, tip of the nostrils, from this thing. But functionally if you say it starts from the mid of the neck, so to the center of the chest where it divides into right and left windpipe. So which is connected to the right and left lungs where it divides into different branches. So it has got a main function in breathing and supplying the oxygen to the body and taking all the bad gas called carbon dioxide and takes out and throws out to make it the body clear from the any wastages.
Now, so lung cancer can happen from here downwards up to the lungs anywhere.
Yes, that's
Correct.
right. So if for the treatment and the differentiation point of view, if the lung cancer is tumor growth which is in the substance, not in the windpipe or something.
Oh, in the
so
substance.
windpipe and this thing, they are categorized into different tracheobronchial tumors. Yes, they all club into thoracic cancers, but lung cancer is little different.
Now, what are main causes of this?
Yes. So, lung cancer, unfortunately, it is becoming very rapidly increasing in incidence.
Is it?
So, yes, very because last, if you consider last decades or so, the incidence was very low. But recently, even in non these things, it was having a impression that lung cancer is mostly seen in men or something. So nowadays, it is also seen in increasing incidence in women. So as all we know, most common cause of lung cancer is chronic prolonged smoking.
Oh,
Yeah, if any person who is smoking any forms of tobacco, either it can be a cigarette, it can be a BD, or a tobacco chewing in the form of any other forms, not only smoking. So any forms of the tobacco which goes either in the form of smoking or inhalation, so it is going to cause a lung cancer, but most commonly inhalation or smoking through the cigarettes, through BD or cigars is the most common cancer. This is the one of the most common cancer, this thing. So as we see, most of the lung cancers, about 80 to 85% of the lung cancers are due to smoking of the cigarettes. So but some other causes other than the smoking are like pollution, other forms of pollution, especially the indoor pollutions. So household pollution we call, we have seen in villages, our grandmothers used to burn cow dung or burn wood. So actually that is not at all healthy, and it is really more dangerous than whatever the cigarette smoking. So that is the second cause, and very less causes like exposure to radon gas, different forms of specific gases or asbestos thing. But most common cause of lung cancer is smoking.
and see, anything that happens to lungs,
Yes.
you breathe in something, something chokes here. Even while eating the food, if the food particles go in the windpipe, you get cough.
Yes.
So cough is the most common symptom where if anything happens
Yes.
to the windpipe and the lungs.
Yeah.
What are the common symptoms of lung cancer?
Yeah.
Mean, in short, how a person would know
Yes.
that this is something uncommon?
Correct. So this is the, because any kind of lungs problem presents as a cough.
Yeah.
So this is maybe one of the reason, usually the patient himself or general doctors himself is get confused and not think of having lung cancer. Because most common symptom which any patient of lung cancer, if he is not all the population or all the humans, in a suggestive or in a specific population, like for example, if he is older than 45, if he is smoking for long time, if he has a cough which is not at all getting controlled, and if any kind of sputum which comes with the cough and which has got a blood tinge or any blood, if he is spitting the blood along with the cough, then you should suspect lung cancer. So most commonly it depends on the stage of the cancer. So what stage, whether it is a early stage, whether it is a second stage, third stage, whether it is spread. So the symptoms presentation of the patient, it depends on the stage of the lung cancer. If it is a localized this thing, it might start with a small cough or start with the sputum with blood, or it can, the cancerous growth can press on the nearby structures of the substance of the lung, that can cause a pain, radiating pain on the shoulder or hand, or if this cancer has spread to the nearby organs, maybe if it has caused a fluid collection of water in the chest, then he might develop a breathlessness, he might not able to breathe properly, so he might gasp for breath. And if this cancer has spread to the neck and compressing some nerve structures, that might cause voice change, hoarseness of voice. So mainly the symptom of lung cancer can be depend on the
staging of the cancer.
Cancer.
Now, just before I ask you, how many stages are there of this cancer? See, if the primary cause is smoking of any kind, then there is no prevalence in children.
No, that's what one the recent trend in the prevalence and incidence of lung cancer is getting really changed. The impression of lung cancer only in smokers, chronic prolonged smoking population is changed. Nowadays we are seeing in our day to day practice number of lung cancer patients who never smoked in their life.
Exactly.
Yeah, and the age actually this is one of those worst cancer, lung cancer. It doesn't respect the age of the patient. So there is an impression that lung cancer means it can be more than 45 years. Why young age patient can? Nowadays we are seeing 20, 25, 30, 35 age group of patients who never smoked in their life coming with the lung cancer.
त्यामुळे जे कोण सिगरेट ओडटात आणि खूप वर्सां ओडटात तांकां लंग कॅन्सर जावपाची चड शक्यता आसा. जशें सिगरेट ओडपी मनशाक हार्ट एटॅक येवपाची चड शक्यता आसा. हें आतां सगल्यांक मान्य जालां. पूण हाजो अर्थ असो न्ही की जे सिगरेट ओडिनात तांकां हीं दुयेंसां जायनात. फक्त तांकां ती जावपाचें प्रमाण कमी आसता, इतलोच ताजो अर्थ. म्हणून कोणाकूय खोकली येता आसत जाल्यार ती सगळ्याच प्रत्येकाक इल्लीशी खांक आयल्यार दोतोराक खंय मेळटलें अशें म्हूण आमी ती सोडून दितात. केन्ना दोतोराक मेळपाचें तें दोतोराक विचारया. सी, if cough is the common symptom of lung cancer, cough is very common. You get it n number of times per day. When is it that a person should think that he should contact a pulmonologist?
True. So that's what the diagnosis of lung cancer is really starts with seeing the exactly patient. So in a suggestive or populations, as I told, if the generally lung cancer involves a patient whose age group is more than 45, who has chronically smoked. Chronically means for long time, very long period, for persistently smoked, and who develops a cough, a recent onset cough, which is not going out at all with any kind of medications. It's called nagging cough.
But then you should wait for about how much? A month?
Yeah, usually more than 2 weeks, 3 weeks. If it is not going at all, then they should think something else is going on. And especially if that cough is associated with sputum with the blood, then you should be really more concerned and you should
start fast.
Along with these symptoms, there may be a weight loss. He might develop a weight loss. He might not be able to eat. So in India, actually suspicion of lung cancer along with tuberculosis, because tuberculosis is a very common disease. So everybody, even the patient or the general doctors, they think cough, blood in the sputum, weight loss, tuberculosis. So this, what we have observed with this, may be one of the reason where early detection of the lung cancer is not happening. It is getting missed, and all of the populations are, most of the population going into advanced lung cancer, and nowadays presentation to us is like a advanced stages. Early stage of presentation is really less.
Coming to the stage again, how many stages are there? And which is the stage? I mean, you can tell how many stages are there, and which is the stage where it becomes symptomatic, where patient develops symptoms.
Correct. So if you see the staging of lung cancer, in technically in our medical terms, we use a system called TNM systems. So I'll just descriptively tell. So T is for tumor, represents a tumor. N is for nodes or glands, which in the body. M is for metastasis, that's called spread. So if you club all these things, there comes a 4 stages: stage 1, 2, 3 and 4. So the presentation of lung cancer can be any of the stage. It can be early stage also. That's what, even the small cough which is not going for with a simple medication antibiotic for 2 weeks can be a lung cancer. So, the stage 1 is kind of stage where the cancerous tumorous growth is confined to one particular lung and one particular place, which has not spread to anywhere. Stage 2 is a little bit bigger tumor, bigger size, and it has touched maybe to nearby structures. Stage 3 you get a 3A and 3B. 3A is a one into the same side of the gland if it is involved tumor, and 4 is other side of the gland, and the stage 4 is other side of the gland or collection of the water as thing, it is the stagings. So, but the presentation of lung cancer can be
at any
stage. Only thing is we have to anticipate and have suspicion of lung cancer nowadays. Yeah.
And what are the tests that are usually carried out to confirm that this is?
So, lung cancer, as I told, the basically examination of the patient, taking a proper history and having a suspicion about, yeah, this could be any cough which is not going, could be a lung cancer is most important thing. But generally, as far as previously we used to start with, usually we start with the chest X-ray, and which might show some spot or some spots here and there. So, that might be a suspicious of lung cancer. So, in that case we will order a investigation called CT scan. So, that scan will clearly tell whether it is a tumorous growth, cancerous growth, the size of the this thing, all those things. These are the basic testings, and there are the tests which are called to see the spread of the cancer apart from the lungs to other parts of the body, maybe to brain, that is called PET CT. But for confirmation, not all this thing, only test which is confirmatory is biopsy. Yes, biopsy is a taking of a tissue from the tumor or cancerous growth and seeing in the microscope and telling, yeah, it is cancer. This is the confirmation. So, to do this test biopsy, we have various tools, starting from a tool called bronchoscopy. Bronchoscopy is a kind of endoscope which is having a long thin tube. In the tip there is a camera. So, we will be passing through the nose and going into the windpipe and checking inside the lungs and seeing if any visible tumors are there or nearby this thing is there, then taking a biopsy from there. If the tumor or cancerous growth is in the center part of the chest, then we use usually bronchoscopic or a newly advanced called endobronchial ultrasound, which is one of the newest advanced form of bronchoscopy. So, with that we do a biopsy and give a confirmation. If the tumor is located near to the chest and adhere to the chest, then CT guidance biopsy, putting a needle through the guidance of the CT and taking a piece and seeing in the microscope. These are the tests which help in confirmation.
The first test which you said, bronchoscopy, does it require general anesthesia?
No, generally it is not required. So, usually is seen in the mild sedation with this thing. But nowadays, yeah, as I told, the endobronchial ultrasound and different forms of endobronchial ultrasound are there. So, which the area of this diagnosis of lung cancer is grown enormously. That is where our speciality comes, interventional pulmonology. So, because previously it was that the impression any cancer tumor is there or CT guided biopsy. That was the general, even with the patient and with the general these things also. But now the advancement of the bronchoscopy techniques using electromagnetic navigation, using even the robotic bronchoscopy techniques have come only for diagnosis only. And also different kind of endobronchial ultrasound. Endobronchial ultrasound means you are doing ultrasound going inside the lung and seeing the structures, and then with the structures you are taking the biopsy piece. So, advantage of this is that you are not going to harm the normal structure or normal blood vessel, and you are not going to damage the blood vessel causing the bleeding or something. So, there are a lot of advancement has happened in this area. So, biopsy is the confirmation for lung cancer.
And with the biopsy, you also know what is the stage of the lung cancer, is it?
Yes, yes. So, without biopsy usually there will not be a proceeding to that any kind of treatment. Once you obtain the tissue and once you see and once you says that this is a kind of cancer, they will be doing a different markers, different stains, immunohistochemical stains and different chemical these things they will be doing. So, along with that all analysis, then they will come to conclusion whether the cancer is this kind and what kind of cancer, whether it is a responsive cancer, whether it is a not responsive cancer, how is the prognosis of this cancer, all this going to be
Now, there is a patient who has been detected, say, with a not actually advanced stage, but a stage before,
Yes.
let us see. Then, what is the treatment? Do you see in usually other cancers of the body, you knock out the part,
Yes.
you remove that part. So, is it same with
Yes,
the lungs?
same applies to the lung cancer. So, as I told, it is a stage 4 stages of the lung cancer as stage 1, 2, 3, 4. So, up to stage 1, 2, 3A there is a surgical chances. So, we can till up to stage 3A you can remove the tumor and completely, not only with surgery, it can be only with surgery or along with surgery there can be a other forms of treatment. But up to third stage and third stage of A, surgery is the can be used for the treatment, and after 3A, 3B and stage 4, surgery has not got any role, has got a very minimal role. So, other forms of treatment combined comes in treatment.
What are those? You have
Yes.
to have chemo.
Yes, in stage 3 and above, usually chemotherapy and radiation therapy, or either alone or in combination of these two. And nowadays, for lung cancer, there is a treatment called targeted therapy. So, targeted therapy means you will be finding some of the genes which are responsible for this kind of thing, and you are going to give the treatment for making that stop those genes to act and make a cancer. That is called targeted. These targeted therapy comes with even with the oral medications, oral tablets. Not chemo means you will know it's all injectable. But nowadays, lot of advancement has happened in targeted therapy, where you give a lot of oral tablets which are very strong, and then they go and target the specific genes which cause the specific mutation which cause the cancer and arrest the cancer.
Yeah.
Yes.
And what is the life expectancy?
Yeah.
See, ultimately,
Survival.
all this is done for us to have a
Correct.
comfortable life. So, after surgery or after chemo, especially of lung cancer,
Yeah.
what is the life expectancy?
Yeah. So, life expectancy or survival, what we
Yeah,
call,
yeah.
is usually depends on what stage of cancer it is. So, if you detect cancer, that is why I wanted to come to the screening of lung cancer,
Please.
how important
Yeah,
is screening in
yeah.
this for going into this.
Correct.
So, screening of lung cancer is very important, because the screening is basically to detect the stage. So, if you detect the stage of early stage of the lung cancer, and if you do a surgical section, the chances survival is very good. So, basically screening, previously they have tried a screening of lung cancer by doing the normal chest x-ray or sputum tests for seeing the cancer cells and all, but that was found to be not effective. Recently, many years back in United States, there was a big trial where a huge number of patients were taken, and they had done those patients was a susceptible population. Susceptible population means the population which are more than 50-55 age group, and who are smoking for more than 25 to 30 years and having some symptoms. These populations were gathered, and they had done a special kind of CT scan for the chest, that is called low dose CT scan. So the dose radiation dose will be low, because not to harm, because we don't know, they are not the patients, they are just going to screen that, and they have found that this low dose LDCT, low dose CT scan of the chest is really has made this thing in detecting the small cancers, small spots. So, when you detect at the early stage, and if you do the surgery plus with other things, the survival is going to be very high. And if you don't detect this thing, the patient is going to have an advanced stage, then the usual general survival rate will be like, if it is in the metastatic or advanced stage, usually 1 year to 2 years, usually they will succumb. Yeah.
But then, say, I mean, it is, we have treated it at the right stage, the patient is got,
Correct.
but then is symptom free. Huh?
Yes.
Like there is no problem in breathing, even
Yes.
if you have done an operation, there is no problem in breathing, doing normal routine work. Is there?
No, there is no problem.
patient
When
becomes
if the surgery is, if the small tumor is there which is removed, because the size of the tumors usually be in the range of 3 centimeter to 4, 5 or 7 centimeters. So, if it is very localized and you are removing that segment or the lobe of particular lobe, and that removal of those things will not affect your, because it is compensated with the other these things. So, generally they will not have, unless you remove whole of one lung, maybe he might develop a little bit this thing, but small lobe, small segment if you remove, and there will not be any breathing trouble for them, they can sustain with the.
Now there is not trend, but now it is usually proved that any type of cancer is hereditary, genetically transmitted.
Yes.
Same with lung.
Yes, some forms of cancer may be familial, but it is of research interest. But as far as I told, most of the 80 to 85% of the lung cancer patients, we have found that it may be due to secondary to smoking only.
Okay.
It is not like all lung cancer patients are
Correct.
this
But
thing.
most of them.
Mostly.
Most of them.
Or whoever smokes, all will develop lung cancer. It's
that
not
is
like
also
that.
yeah. So सिगरेट ओडटा ताका जातलोच अशें ना, आनी सिगरेट न ओडटा ताका जावचो ना लंग कॅन्सर अशेंय ना. पूण साधारण 45 वर्सांच्या वयर वय आशिल्ल्या आनी जो जवळ जवळ 20-22 वर्सां म्हणजे कॉलेजांतल्यान वचपी सिगरेट ओडपी भुरगे आसात अजुनूय, ते ओडत रावतात सिगरेट आनी दिसाक 4-4 पाकिटां ओडटात. सो हांकां लंग कॅन्सर जावपाचे चान्सीस हे बाकीच्यांच्या परस चड. आनी लंग कॅन्सर एकदां जालें जायत जाल्यार मागीर ताज्या खातीर कितें 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 करचें पडटा तें डॉक्टर प्रभुदास हांचे कडल्यान आमी आयकलें. सो हें सगळें करच्या परस सगळ्यान सोंपें इज क्विट स्मोकींग. सुरवातूच करप न्ही हें खरें, पूण एक एकदां फ्रेंड्साक सर्कलाक लागून जाता, मजेक म्हणून सुरवात जाता, पूण ताजें एडिक्शन जावंक जायना. तें करूं जाय आनी बंद करपाची तांक आपले कडेन आसूं जाय. सो म्हाका दिसता एक अतिशय म्हत्वाच्या अशा विशयाचेर, ज्या विशया बद्दल आमकां खबर नाशिल्ली, आनी डॉक्टर प्रभुप्रसाद सारको मनीस आज मणिपाल हॉस्पिटलान आसा आनी मणिपाल हॉस्पिटलान ही सोय आमकां करून दिल्या की 45 वर्सांच्या फुडें खोकली येता, सगळीं वखदां जालीं तरी खोकली वचना. आतां सिगरेट ओडिना पूण पयलीं ओडल्या, ना आतां हांव ओडिना अशें म्हणटात. हांव सिगरेट सोडल्यार जालीं 10 वर्सां, पूण 10 वर्सां पयलीं तुवें 20 वर्सां ओडल्या सिगरेट. ताका लागून ती खोकली वचना, खोकलेंत स्पुटम येता, तातूंत रगत जाल्लें दिश्टी पडलें जाल्यार आनी चड वेळ खर्च करपाचो ना. डॉक्टर प्रभुप्रसादा कडेन वचपाचें, ताका सांगपाचें बाबा रे पळय तुवें सांगलां म्हूण आपूण तुमचे कडेन आयलां, पूण सगळ्यान म्हाका दिसता बरें जें आपल्या हातान आसा तें म्हणजे स्मोकींग बंद करप.
Yes.
Dr. Prabhuprasad, thanks very much. You have come and given a nice overall idea about a disease or a problem which was not so far brought to the notice of the common people. Everyone thought that you have cough, so you have either asthma or you have bronchitis, and then you would go from hopping from doctor to doctor, neglecting the main cause. So thanks very much on everybody's behalf.
Thank you very much.